8 signs your body gives you a month before a heart attack. Heart attacks are usually sudden, tragic occurrences that can seriously disrupt your life or even be fatal. However, the signs appear and build up a lot earlier than you'd think, in the mild pain or discomfort that we might ignore. But not all heart problems begin in the chest. Sometimes they develop from a poor lifestyle or other conditions. If you're dealing with obesity or diabetes, high blood pressure, or cholesterol, then you have to know about these 8 signs that your body gives you a month before a heart attack. Even if you are strong as a bear and healthy, it would still be good to know how to prevent heart problems from building up into a heart attack. Before we proceed, please note that everything mentioned in this video is unbiased, fact-checked, and reviewed by qualified health professionals. With that said, let's jump in and talk about 8 signs your body gives you a month before a heart attack. Number 1. Dizziness and lightheadedness. If you experience feelings of disorientation, lightheadedness, or fainting, you might be having heart problems. Dizziness could be an early sign of a heart attack. It's true, you can faint and lose your balance for various reasons. Sometimes it happens when we stand up too fast or are dehydrated. However, if you suddenly feel dizzy without any reason and also experience chest discomfort followed by shortness of breath, you should see a doctor immediately. It could mean a drop in blood pressure as your heart is unable to pump the way it should. Number 2. Chest pressure. This is probably the most common sign that something is not right with your heart. When an artery is blocked, you will feel pressure or tightness in your chest. Some people might say their chest is burning or that they feel like a heavy object is sitting on their chest. But how do you differentiate between chest discomfort caused by a heart problem and any other chest pain that might arise for other reasons? If it's just a short, fleeting pain and there's a spot you can touch or push on that hurts, then it's not a heart problem. Either way, you should go see a doctor. If the symptoms keep getting severe, call 911. Number 3. Chest pain that spreads to the arm. One common sign of heart attack is chest pain spreading to your arms. Usually it's the left arm, but it could also be both. It might also affect your neck, back, or jaw. However, in some cases, people might not even feel chest pressure, but only arm or back pain. These alone can also indicate a heart attack. So if these symptoms are attached to shortness of breath and other risks of heart attack, you should go see a doctor right away. Liking our video so far? Before we move on to the next sign, don't forget to hit the like button and subscribe to our channel so you never miss out on new informative videos. Number 4. Nausea and vomiting. Indigestion, heartburn, abdominal discomfort, nausea, or vomiting are also signs of a heart attack. Studies show that women are more likely than men to experience these symptoms. Of course, you can have an upset stomach and nausea for many other reasons other than a heart attack, but you need to be aware that these can also be associated with heart problems. Number 5. Throat pain that spreads to the jaw. Throat and jaw pain are not directly related to heart attacks. By themselves, they could indicate a sinus problem, a muscular issue, or a simple cold. However, if followed by other symptoms, such as chest pain or dizziness, they might represent a serious heart issue. Call 911 or seek immediate medical help in case the pain and pressure doesn't go away. Number 6. Excessive sweating. If you feel you're sweating more than usual while doing normal activities, then you could be dealing with clogged arteries and heart problems. When arteries are blocked, your heart goes into overdrive mode to pump blood, so your body will sweat more to try and keep the temperature down. If excessive sweating or sudden cold sweats are followed by lightheadedness or dizziness, you should seek urgent medical attention. Number 7. Inexplicable coughing. Coughing that lasts for more than 2 weeks can signal a more serious problem. If you're coughing and also producing a white pinkish mucus, it might be because your heart is failing. What happens is that the blood builds up in the pulmonary veins because your heart can't keep up with your body's demands, and fluid will leak into your lungs. This is a serious symptom, and you need to see a doctor right away. Number 8. Unusual heartbeat. When we are excited or anxious, fidgety or scared, it is normal for our hearts to race or skip a bit once in a while. However, if it happens too often, go see a doctor. It might be because of too much coffee, stress, or insufficient sleep. However, it could also be an early sign your body gives you before a heart attack. So it's always better to talk to your doctor. But it's even better to make good lifestyle choices that will prevent you from ever having to worry about a heart attack. Let's now look at 9 ways of preventing heart failure. Number 1, quit smoking. Easier said than done, isn't it? We know smoking is an addictive habit that some people just can't shake off. However, smoking is also a big contributor to heart problems. Studies have shown that smoking is one of the main risk factors of coronary heart disease and strokes. When we smoke, plaque builds up in our arteries, making them harder, potentially leading to atherosclerosis. Smoking can also decrease your amount of good cholesterol and raise your blood pressure, which increases the chance of heart disease. So, try to say no to cigars and keep an active, healthy lifestyle. Number 2, understand your risk. Your risk of having a cardiovascular event depends on certain factors, starting with age, family history, habits, and other medical conditions you might have. Understanding these risk factors can help you be more prepared and aware of your health. Talk with your doctor about this and estimate your risk of having a heart attack in the next 10 years. Number 3, get at least 30 minutes of activity a day. Regular daily physical activity has a lot of health benefits for us. First of all, it's one of the best ways to control your weight, reduce your blood pressure, cholesterol, and the risk of type 2 diabetes. All these combined are also good for your heart. You don't have to strain yourself too hard. For example, in 1 week, you can do 150 minutes of mild aerobic exercise like walking, 80 minutes of a more active aerobic activity such as running, 2 or 3 strength training sessions. These will be enough to keep your heart healthy, boost your mood, and have generally good vibes all day long. You'll see that physical activity really does make you happy. Number 4, eat fiber-rich grains, legumes, and lean meats. Fiber-rich grains such as oatmeal or brown rice help improve your cholesterol levels, thus lowering your risk of heart disease, obesity, and even type 2 diabetes. Legumes are also perfect for a healthy heart and lifestyle. Try adding more lentils, black-eyed peas, dried beans, or chickpeas to your diet. When it comes to meat, go for fatty fish and lean meats. Whether it's chicken or turkey, poultry is great. Fatty fish like salmon, trout, and tuna are rich in omega-3 fatty acids, and that makes them real powerhouses when it comes to good nutrition. You see, food is basically one of the best medicines we have on this planet. Let's use it, shall we? Number 5, keep an eye on your weight. Obesity is a risk factor for heart diseases, and unfortunately, it affects a lot of people. According to the Centers for Disease Control and Prevention, CDC, over 73% of Americans are overweight and nearly 43% are obese. So always keep an eye on your weight. Try to lose some weight if your BMI is not where it should be anymore. Having an optimal weight will help regulate your blood pressure, glucose, and cholesterol levels. If you're struggling with your weight, you can talk to your doctor or a nutritionist and follow a diet and exercise plan. Nothing is impossible. Number 6, lower your blood cholesterol. Fat housed in your arteries can lead to a disaster by triggering a stroke or heart attack. To eliminate the risks, you have to reduce your intake of trans and saturated fats. Sometimes physical activity and diet might not be enough. Medication might be needed, but only a doctor can prescribe that. Don't try miracle solutions on your own. So, you need to lower your LDL cholesterol, the bad cholesterol, and increase your HDL, the good cholesterol. Triglycerides represent the most common type of fat in your body. The worst-case scenario is a high triglyceride level combined with a low HDL cholesterol and high LDL cholesterol. This can lead to fatty buildups in your arteries and significantly increase the risk of heart attacks. So, keep your cholesterol in check if you want to have a healthy heart. Number 7, keep diabetes in check. Diabetes is also a heart disease risk factor. If left untreated, it can lead to peripheral artery disease, stroke, and other heart conditions. You can have diabetes and lead a happy, relatively normal life if you take your medication, get regular checkups at the doctor, exercise, and have a healthy diet. So, do all these to reduce your risk of more heart-related complications and threats on your life. Number 8, get good quality sleep. Sleep is so important for our bodies. Unfortunately, we don't really give our bodies the good quality sleep it needs. Adults need at least 7 hours of sleep per night. This is the time when our bodies recover and heal. Studies show that sleep can reduce the risk of high blood pressure, heart attack, and depression. Unfortunately, we live in this hustle culture that advocates for working your heart out and sleeping very little. That is so wrong. Make sleep a priority in your life. Number 9, get regular health screenings. Always check your health and see how you're doing. Regular health screenings can show you if something's wrong early on. Get your blood pressure checked and have your cholesterol levels measured. Do it regularly to make sure your body is fit and well. After all, our health is our most prized possession. Let's take care of it. Enjoyed this video? Hit the like button and subscribe to our channel for more informative videos like this one. Thanks for watching. Your wellness is our mission.